Hello all. On behalf of the HSE Mental Health Engagement and Recovery team and all our partners, I'd like to welcome you today to a follow-up discussion with our panel of experts from the Family Recovery Conference. The conference was held on the 15th of May and it was entitled Families Together for Mental Health. We would like to thank everyone who submitted questions on the day. We were unable to get to those important questions on the day, so that's why we'd like to revisit them now. We wanted to respond to these questions via video, as this will be a resource then that is widely available. I would like to thank the panel for making themselves available for this. And finally, I would like to thank all of the members of the Family Recovery Advisory Group who organised the event. I will hand you over to Michael Norton and Gina Delaney, who will co-facilitate this discussion.
Thanks, Aisling. Myself and Michael would like to first of all introduce ourselves and then ask each of our panelists to introduce themselves, and then we're going to get right into the questions and responding to the questions. So my name is Gina Delaney and I'm a development officer with Mental Health Ireland for the South East, and I also have the responsibility of family recovery. And my co-host, Michael Norton, will introduce himself.
Hi everyone, my name is Michael Norton and I'm one of the National Engagement and Recovery Leads with the Office of Mental Health Engagement and Recovery. And I was your MC for the panel discussions that we had on the Family Recovery Conference Day. And now I'm going to pass you over. So the first person to introduce themselves on my screen is Patricia.
Hi, my name is Patricia and I'm a family member and I serve on the National Council for Family Recovery, and I also do some work in my local area.
Good afternoon, everybody. My name is Derek Pepper. I'm the team leader for regional services with an organisation called Shine. Shine are a national organisation providing recovery-oriented support services to people with self-experience of a mental health difficulty, and crucially to the family members as well who are supporting those individuals.
Thanks, Derek. Maria, would you like to introduce yourself?
Yeah, sure. Hi, my name is Maria McGoldrick and I'm a family peer support worker with a service called Balachnua. And I'm also the area lead for mental health engagement and recovery for Galway, Mayo and Roscommon. And I'm delighted to be here today. Thank you.
Thanks, Maria.
Pleasure.
If we can pass over to Alison now.
My name is Alison, as Michael said. I'm a family member. I also have my own lived experience, and I have worked in peer support and studied peer support also. Thank you.
Thank you, Alison. And we'll pass on to Sushil.
Hi everyone, my name is Sushil Teji and I'm a family member and also do some work with the National Family Advisory Group, as well as doing work in our local community on forums.
Thank you, Sushil. And the final person, and not least, is Kerry.
Thank you very much. Hi everyone. My name is Kerry Cuskley. I'm a principal social worker in mental health in North Dublin at CHO9, and I'm the co-chair of the National Family Recovery Advisory Group, and I'm delighted to be here.
Thank you, Kerry. And now what we're going to do is go straight into the questions. So both myself, as Gina mentioned earlier, both myself and Gina will facilitate these questions, and our panel, who have just introduced themselves, will answer them. So I'm going to pass you over now to Gina, who's going to ask the first question.
Brilliant. Thanks very much, Michael, and thanks everybody. So our first question is there a bad time for family to be involved? And Sushil, I think you're going to come in with an answer for that one.
Yeah, thanks, Gina. I think to answer this fully, we really need to consider the context in which we consider involvement. So, for example, as a family member, it's understandable that you'll want to seek assurances that your loved one is receiving the appropriate level of support from the health service, and that you are providing the support that's required. However, the timing for this has to be agreed with the mental health team. tasked with supporting the service user, because in some cases it may be necessary to actually step back in the short term. And the other context, of course, is recognizing the needs, your needs as the family, and the support required to help you get through this. And for this, I would really say there is no bad time. In fact, the sooner the better. And again, guidance should be taken from the team assigned to the service user. And in some cases, you may be told, oh, you know, due to confidentiality reasons, we can't discuss this case. However, you need to reinforce the point that actually it's your needs you want to be raising and addressed, as there is no need to compromise the service user's confidentiality. And later on, I think we're going to hear from Maria, who will also give some more information about this very topic. Over to you, Gina.
Brilliant. Thanks very much, Cecile. Really appreciate that now. And we have another question, haven't we, Michael?
We do. And this one is addressed to Kerry, if that's okay. So over the course of the Family Recovery Conference, we received a number of questions in regards to access. And it's so a number of questions have come up in regards to access. And to start with, it's access generally to the services. If someone is looking to get access to services, how can they do that? And then specifically around ADHD as well. If someone has ADHD, how can they get access? And I suppose the final part of the question for you, Kerry, is in regards to the transfer from the child and adolescent mental health services to the general adult services, and how can people kind of get access to that transfer, and how does that work? So over to you, Kerry.
Great, thanks, Michael. Yeah, so I suppose there's lots of questions within that question, but yeah, I mean, very often for people, they may not think about how to actually access any service, let alone a mental health service, until the time comes, and they may be in a crisis or in a situation where they're actually thinking, how can I get support I need? And whether that be the person themselves looking for your own support, or as a supporter trying to help somebody that you know or love access services. And I suppose, like every other service, mental health is part of the wider health and social care services. And the way our health system works currently is that our initial point or our initial stop is to always go to your GP and to try and get signposted from there. So in a nutshell, that's your first port of call. Now, there's lots of stuff you can do before that, which is to, I suppose, look information up yourself, get a sense of what's out there, talk to other people. There's lots of services, I suppose, outside of mental health services and primary care services that you can access as well. But I suppose the first point of contact would always generally be your GP. And I suppose in terms of actually accessing service, the idea for mental health services are that really the majority of people who have mental health difficulties are meant to be supported at that GP or that primary care level. So you'll often hear the words primary care. So that's a GP, that wider public health nurse, community occupational therapists, primary care social workers, all of that kind of wider, broader piece, community groups, community NGOs like Shine and Family Carers Ireland, etc. So all of that kind of wider piece, and Mental Health Ireland, of course. A wider pool of kind of community level resources. That's really where people will be signposted and supported at to begin with, ideally. And if that's not enough, or if that's not relevant or appropriate, then your GP will be the person to refer you into the kind of the tertiary or the secondary services, which would be the specialist health service. So I suppose within that, it's really important for people when you're initially going to your GP or talking to somebody is really trying your best to be clear about what it is you're actually seeking in terms of information, what it is that you're hoping to get out of your appointment or your discussion with your GP or with whoever you're talking to, and also asking for very clear information, because a lot of times people are not really sure, and I think that may be kind of where some of the questions were coming from as well. People are not necessarily they don't have full information, which then makes their journey or their situation a little bit grey or a little bit, it lacks a bit of clarity. So it's really important for people then to ask very clear information. So who is going to send my referral? When is it going to be sent? What will happen then? What information will I be given? When will I see somebody? Who will I be seeing? So asking all of that very practical information that you're perfectly entitled to ask and that you should be told, which will hopefully then help in that kind of transition from primary care to mental health service kind of level. And that's the kind of general route of access. Of course, we can be in crisis at times, and sometimes something happens right now and we may need to bypass all of that. And generally what will happen if somebody is in a mental health crisis is they will probably go to A&E, is where you will probably go first of all. You will actually be seen there by somebody from a psychiatric liaison team, and then you will either then go to an acute inpatient unit if that's needed, and hopefully that won't be, but that is what can happen if needed, or you will then be referred directly back to your community mental health team and kind of bypassing the GP piece, because to do with crisis, obviously. So there are a few little different ways of getting in, but they're the two kind of general ones. I suppose in terms of specific conditions, and I know one of the questions were around ADHD, again, your first point of contact to ask these questions is your GP. Your GP will always be the one who does that first initial conversation, that first initial assessment, and then will refer you to the specialist service you need. Same for mental health as it would be if you needed to be referred for specialist physical health services. In terms of the transfer piece, if somebody's already in the child and adolescent mental health services and they need to be transferred, or they need to continue to get mental health support when they transition into the adult services, that will happen between service to service. So again, it's important when you're coming up to that transition piece that you, whether it be you as the person who's attending the service or the family member, proactively ask those questions of your CAMS team. So asking for a meeting and asking to sit down and talk to your team. What is the plan? What is going to happen? How is that going to happen? When is that going to happen? Who are you referring us to? What are the contact details for those people? And they all seem very practical, but again, that will help them with the transition because you will know what's happening. And it just might be that the teams might just assume that you know what's going to happen, but very often it's just that questions aren't necessarily asked, or people don't know that they can actually ask them. But please be prepared, and it's no problem to ask those questions. You may need to write things down before you go in. Bring somebody with you. You're perfectly entitled at all times, no matter what health service we all access, to bring somebody with us to support us in it. And if we're not able to ask the questions ourselves, we can have somebody ask them for us, or we can write them down beforehand and literally give those questions written down to our healthcare provider. That is all absolutely fine. So that's, I think, a general ballpark. I would actually suggest, and it's not because I work in the HSE or anything, but I think actually the HSE website is a really good first point to actually look up information if you have any kind of questions like that. For example, I just literally myself, just pretending I was a member of the public, just literally Googled ADHD and HSE, and it brought me right to the ADHD section of the HSE website, and it just gives very, very clear, very easy to read signposting information for that particular issue. But again, it will do that for most health conditions as well. So again, going to some sort of reputable information on the web, having it checked there, but again, going to your primary healthcare providers as your first point of contact, and they should signpost there.
Okay, that is so helpful, Kerry, and just like the way you've explained that is really helpful. And I think sometimes, like when you go, like if you read a leaflet, or if you go onto a website, it can it's so helpful to have somebody say it in such a straightforward way, and it kind of just gives you confidence then to go onto that website or to read the leaflet, because it helps to reinforce what you've said there, and even to say, bring in those questions and ask them. It's amazing that sometimes you don't feel like you can ask a question, or you might even know kind of what sort of questions to ask. So you've really helped there just to lay it out in plain English. So thanks very much for that. And you've also, I suppose, helped to set the scene, as well as Sushil in his answer to the last question, for the next question. So the next question then is for Maria, and it's, what can you do if the team will not deal with you and the treatment of your loved one can't be discussed? What advice would you have there, Maria?
Yes, I suppose I'm glad to be asking that or answering that question for you, because it's quite a common one that I experience in my work as a peer support worker for families. And I suppose it's just important to realise that that's quite normal for consent not to be there at the beginning stages of a mental health difficulty, and just to realise that that is something that needs to be respected from the professional's point of view. Also, they have a legal obligation to ensure the person they're supporting confidentially is respected. However, it's most important that family members remember, just because consent is not there and the professional can't speak to you, you can speak to the professional. So if you fear something is going on in the background that the team may not be aware of, it's important that you communicate that to the team. Don't be afraid to pick up the phone and tell them what's happening for you and what you're seeing yourself, because quite often we are the experts in the person we're supporting, and we can see things maybe that the professionals can't see. If you find, of course, that you're not being heard, or that they are quite reluctant to speak to you, you can write in, and I would recommend letters are a great way of ensuring that you're heard by the team. Thank you.
And I suppose, Jean, if I may come in myself on that particular note, because I think Maria has really summed everything up perfectly, so she has, but just to emphasise, I suppose, some of those points that situations like this can arise quite regularly, so they can. And just because initially a loved one, you know, a person with self-experience might say, no, I don't want my family involved, that's not to say that that stance will remain the same in the long term. So it's always important from the point of view of family members who are supporting a loved one with a mental health difficulty to try and maintain that dialogue to see, well, you know, would it be okay if we are there to support you in cooperation with your mental health team, that we would have permission maybe to share information with your doctor, with your nurses. And I think being able to have those discussions at home with our loved one whenever it's appropriate is important, because that helps to develop that sense of trust and companionship and togetherness in that journey of recovery. And then, of course, it makes it much easier from the point of view of family members when they do want to deal with professionals, because if that consent is given, and it's given, I suppose, from the perspective of the person with self-experience, whereby they acknowledge that this is actually a good thing. You know, this is basically helping me to support myself and to develop a relationship with the mental health professionals in my family. Once that context is there, it definitely improves the situation for everybody. So it does. And as Maria also highlighted, even in situations whereby relatives don't have to receive information from the mental health professionals, the only people who really know what the benchmark of wellness for any individual is the people who love them, the people who know them all of their life. They know what that person is like when they are well. So the information that those relatives are able to share with the mental health professionals is invaluable. It's vital. And I remember many years ago speaking to a consultant who actually shared that with me. You know, the consultant said to me, they said, you know, I don't really know what an individual is like when they are well. Unfortunately, when I get to see them for the first time, they are unwell. So I don't know what their personality is like. So it's brilliant when a family member can inform me of what I need to work towards, what I should be seeing in a person to know that they are actually improving. So the information that relatives can share with the professionals without asking for anything in return is invaluable. And I would always encourage relatives to feel that they can go and approach professionals and talk to them and share that bit of information with them. And in doing so, I suppose what we're doing is we're also developing a rapport and an understanding and a relationship with the professionals as well. And that's important also.
Thank you for that, Derek, and indeed Maria. What I found really interesting in what you're saying is that from both of you seem to identify that the family member have their own expertise when it comes to knowing what the person is like when they're well and knowing what the person's like when they're unwell. So really the family is a really, really good resource. And it's very, very heartening and very hopeful to hear that even though sometimes our relatives, if they're sick or if they're unwell, they don't want us to know confidential information, our view is still being heard, even at that stage. So that's really, really hopeful and heartening to hear. So I'm just going to pass you on to our third question, and this again is going to Kerry, and it's in relation to services in the UK, comparing it to here. And should a family assessment by the services be a right by law as in the UK? Kerry.
Thank you, Michael. Yes, that's an interesting question, and I think it's got pros and cons to it in terms of the legislative piece. But I think just to start off with, in terms of the discussion around family assessments, family needs assessments, I think that's incredibly important. I think it's vital, and I think it has to be a core part of mental health service provision now, if it's not, and going forward, sure. I suppose one of the wonderful things that have come about in the last few years with the mental health, the recovery framework document, is the family recovery guidance document along with it, that specifically talks about, for the first time as far as I can see, specifically talks about families having a need and a right to have assessments in their own right. And it's not necessarily about an assessment to see how a family member or a supporter can support their loved one, which is important, but it's also the other piece about what do I or what does somebody need as a supporter in my own right, in my own recovery and my own journey as I go alongside my loved one. And then an assessment to look at me as a supporter in my own right, I think is incredibly important. And I suppose that exists in a few different forms in the mental health services, as in, for example, in our BFT, our Behavioural Family Therapy Programme that we run, which is run nationally, obviously, through the Early Intervention and Psychosis Programme. As part of that, we do individual needs assessments for all members of the family. So that includes all members of the family, which is great. So it's an actual process where we really do try to, I suppose, work with and listen to and hear and support everybody in the family, service users, family members, supporters, in their own right, and look at their own goals for their own recovery, as well as working as a family to support the person experiencing psychosis. But I think in broad terms, I think it would be incredibly important to work toward the time where it's just an automatic that everybody who identified as a supporter is also given access to an initial needs assessment, the same as a person who is experiencing the mental health issue gets an initial assessment when they enter the mental health service. And there are lots of different ways of doing that. One is by legislation, like they have in the UK, which has its pros because it does mean that you have a legal right to something. The problem with that is, but just because you have a right to an assessment, it doesn't automatically mean that resources and interventions and everything follows with that. So there's a little bit of doing and throwing around that. I think there's a lot of merit in at least looking towards incorporating mental health needs and supporters' needs much more broadly and integrally in the next iteration of the care strategy document, which should be reviewed in around now or coming up soon. So I think really prioritising family members and supporters in the mental health sphere specifically, I think just making sure that is really up front and centre, because I suppose in terms of work with families over the years and just in my general interest in working with supporters in mental health, it's not as recognised or understood necessarily as maybe caring or family or supporter roles in other areas. For example, maybe caring role for somebody who may be older or have dementia, or a caring role for somebody who is a child or a younger person with a disability. Those roles in terms of family members are maybe more recognised in the kind of broad sphere, also in research, but not necessarily with mental health. It just seems to not be so much understood in the public. So I really think anything that moves that forward is incredibly important. And I think I'm not going to come down either way in terms of the yes and no around legislation, but I certainly do think we need to strongly invest more in supporters and families going forward.
That's brilliant, Kerry. Couldn't agree more with what you've said there. It's just so important that families are supported in the broadest sense, and quite often we've seen it. I know I've seen it. You've all seen it, where people have been supported and have gotten the mental health services that they've needed for their own recovery, but unfortunately the family have still been dealing with the crisis and the trauma, and that then has had an impact on the person often when they go home to the family then, because they haven't been supported themselves. So thank you for that. So we have another question now, and this is going to Patricia and also to Alison. And the question is, what has been the most significant changes over the years? And are we doing enough as a service? And what else could be done to help?
I suppose what the questions that have been answered already have actually shown how much the services have changed, really. I suppose the biggest change I see is that there's an understanding and an acceptance that mental distress affects more people than the person with the diagnosis. The wider family and the person's supporters will be affected in some way or another as a result of a serious mental health issue. And they will have their own journey towards recovery. Now, really listening to the previous speakers, you know, Gina was, Kerry was able to itemize the different places you can find all the information now. I suppose that's a thing that's available now that wasn't before, you know, in previous years. I will accept that always in my situation that I was always able to speak to the doctors, and but I suppose what I was trying to offload what I felt and what I knew, which is what we've decided, which has come up with the other speakers, that's helpful, you know. And I don't think at that time our family that we realized what help that was. It was a help to us to get it off our chest, but I don't think we realised what a help it is really to the consultant in knowing the person they're looking after and all that, you know, during their hospitalisation or their attendance at a, you know, a psychiatrist or whatever. But it is important to note that the family does have their own recovery journey. For a long time I thought, oh, the recovery is all about the person getting well and then we'll all be fine. But it isn't as simple as that. It does take time for the family members to acknowledge to themselves that they have to recover as well. But I do think there's lots of things out there now available. So it is a better situation.
So for the second part of that question, do we need to do more as a service? Well, I think there's always room for improvement. And I suppose with regard to what could be done to help, I feel that there's a great benefit encouraging the individual to include their family or supporters, whoever that may be, on their recovery journey with them. And while it's great that it's recognised now that family members, supporters, carers need their own support too, if staff maybe at times didn't just look at these as two separate entities, so rather than seeing it as an individual with a need and then others who also need support, look at it actually as a duo or a trio or whatever it may be. And in fact, the staff can join this team, if you like, and everyone can work together. Because I think a collaborative approach can be really impactful and really helpful. So to see that as they're not two separate things, you know, it's something that can be done together. It's not to say that family members don't need support in their own right, family members or any supporters or people involved. So I think also that signposting whatever is out there to help and early on for those people is also something that's really important. Thank you.
Perfect. Thank you, Patricia and Alison, for that. And it's really interesting that a lot of your answers to that question really resonate with other parts of the questions that were asked already, and how that really the family is a source of knowledge. And it's only now that services are starting to kind of pick that up, so to speak. So that's really, really interesting to hear, and it's really is powerful for the future of family recovery in Ireland as well. That professionals finally see that family recoveries and family members' views are just as important as everyone else's views in the table. So thank you for that. I'm now going to turn to Derek for the next question. So Derek, if I can ask you, what advice would you have for working with an individual whose recovery goals may be different from the family recovery goals?
Yeah, I suppose this is something that can happen quite often. When we talk about recovery, and as you've rightly outlined there, Michael, and indeed Patricia has touched on it as well, that journey of recovery, in essence, you could say there are two very distinct journeys of recovery when we talk about recovery. Yes, there's recovery for the individual who has self-experience of a mental health difficulty, but there's also a very separate and distinct journey of recovery for members who are supporting that individual. And it's not always going to be the case that these journeys of recovery will run parallel to one another. In some instances, the individual with self-experience may be enjoying a really good recovery. However, for whatever reason, the family members may not really be living the journey of recovery that they should be living. Vice versa, you could have a situation whereby a person with self-experience is not advancing in their recovery for various reasons, but the family members have accepted the reality of the situation. They understand that there may be limits to what their relative can achieve at this particular stage, but even within all that, they are still living their own lives. They're still pursuing the things as family members that they want to pursue. And that's vitally important. And when we realize that there are two distinct journeys of recovery, hopefully then we can come to the realization that my journey of recovery is not dependent on the recovery necessarily of the other person. That even if the other person is not enjoying a great journey of recovery at the moment, it doesn't mean that I can't still work on my own recovery. So from a relative's perspective, to be very specific, if my loved one with self-experience is going through a difficult time at present, it doesn't necessarily mean that I have to hit the pause button on every aspect of my life and only resume that when my loved one becomes well, because we never know how long that process may take. So it's important as relatives that we still invest in our journey of recovery, even during times when our loved one may not necessarily be enjoying a similar type of a journey of recovery. But it's still important as relatives that we keep investing in ourselves, that we keep looking at those aspects of life that are important to us, like our profession, like our relationships, socializing, hobbies, all these different things. We can't become martyrs. We have to keep living the life that we want to live. And the very same applies to a person with self-experience. Be able to live the life that they want to live, regardless of what the views and opinions may be of their relatives and people outside of that. It's very important that on both sides of the fence, we respect the fact that each individual is entitled to live the life that they want to live and aspire to achieve the things that they want to achieve, be that a person with self-experience or a relative.
Thanks, Derek. That's really helpful to hear that, and I think it's really important to hear that as well, because sometimes, you know, you mightn't realise it, you know, as a family member, that you mightn't actually realise that you do have choices, you know, around how you can look after yourself as well. So it's great to hear that being said out loud, so that people can kind of think about it for themselves in their own lives.
And also, I suppose, just to add to it, recovery essentially is about hope. You know, it's about giving people hope. And sometimes we have to do that most of all during our most difficult times. So if we do experience our loved one going through extreme difficulties, we still have to maintain that sense of a journey of recovery for ourselves, because that gives us that sense of hope that we will come through this. And very often we will come through this together. And by doing that, we hope that it will also encourage our loved one to mirror our approach to life as well. That when they see us achieving our journey of recovery or chasing that journey of recovery, it will encourage them to do exactly the same.
Thank you. That's brilliant, Derek. And would you mind talking a little bit more, Derek, about, say, the role of recovery education and co-production in supporting families in their recovery?
Yeah, I suppose from the point of view of a voluntary organisation like Shine, we've been very much involved in the development and the delivery of recovery education programmes for 15 years or more now at this stage. You know, you could say that the voluntary sector were the pioneers of recovery education courses, and that's still very much the case today, although it's fantastic to see the amount of collaboration that has developed over the course of the last 5 years. We've so many organizations working together now in unison to develop fantastic projects and initiatives around recovery education, and it's brilliant to see these things being brought forward. And really, this is the future. And from the point of view of the mental health services, they've been able to see how vitally important it is that recovery education programs are developed and delivered in the community. And I suppose the real reason for that is that the point I mentioned just a couple of minutes ago, hope. You know, hope is the most fundamental thing that any professional, be they in the mental health services or in the voluntary sector, can give to any individual who's engaging with them, be that a person with self-experience or a relative. We all need that sense of hope. We all need to believe that things will get better. And recovery education provides us with a sense of hope that, yes, things can get better. Once I start to develop an understanding of what recovery is from a mental health perspective, it gives me a greater insight into, yes, into the illness side of things, but also into life, you know, and what we can do as individuals to try and enhance that experience of recovery. And that's why, yes, some aspects of a recovery will involve a dependency to a certain extent on other people, because yes, we do have to reach out for help and support. But what we also realize through recovery education is that we can draw on a huge amount of resources from within ourselves to enhance that journey of recovery. And I suppose when you look at it from the perspective of people with self-experience and from the relatives' perspective, I suppose when we talk about recovery, probably the first thing that happens is we look at recovery from the perspective of the individual with self-experience. And that's very important for relatives because, again, it goes back to that point of hope. As relatives, if we can start to develop hope for our and realize that this diagnosis that we have just received, be it depression or bipolar disorder or schizophrenia, and very often, unfortunately, at that point, particularly with an initial diagnosis, people may be working off misinformation that they've received over the years, misguided information, that to a certain extent leads them to believe that, oh no, this is terrible, this is catastrophic. Whereas with recovery education, we get to, I suppose, inform people and make people aware that actually that's not the case. You know, the reality is that people recover, people get better, people get to go and achieve the things that they want to achieve. Yes, maybe their lives go in different directions, but isn't that fantastic? You know, because it's self-determined by the individual. I know people who have self-experience who have spoken to me at length about this and have described that journey of recovery as being like a journey of exploration and discovery, whereby they have explored various aspects of their lives and personality they never would have dreamt of looking into before. And because of that, they've discovered so much more about themselves than they were ever aware of previously. Discovered various different abilities, skills, you know, so much more about themselves on a personality level even than they ever realized that they ever had previously before working on the recovery. And in doing so then, I suppose it feeds into the relative's perspective. Because very often relatives might look at this situation and they can become frightened. They can think, well, will my loved one be dependent on me for the next number of years? Is this going to map out the rest of our lives? Will this affect my employment? Will this affect my finances? Will this affect my future dreams and ambitions for when I want to retire or whatever it might be? These are all the questions that tend to arise for relatives. And again, by informing relatives and making them aware of their individual journey of recovery, we get to let them see that by making the right choices, they can live the life that they want to live. And that's a vitally important message that relatives need to hear. So that's why recovery education is so important, both for people with self-experience and relatives. Now, from the delivery and the development of those programs, the point you mentioned there, Gina, about co-production is also vitally important. And over the last number of years, we've seen the value in co-production and co-delivery. And when I talk about co-production and co-delivery, essentially what I'm talking about here is a collaboration. Cooperation between people in the services, be that the HSE or in the voluntary services, and including the voices, the opinions, and the experience of people with self-experience and relatives. It's vitally important that when you want to develop an education program, that everybody is around the table. Everybody's voice, everybody's experience, and that lived expertise that they have developed is brought into the equation and recorded and used to develop those programs. The program is developed and everybody has had a sort of a contribution to it. When you go to deliver it, again, it's vitally important that everybody is involved in the delivery. So yes, you may have a voluntary sector professional like myself delivering a course, but in tandem with me and in cooperation, I may have a relative delivering that course with me. If it's a course that's appropriate for people with self-experience, I will have a person with self-experience who's beside me delivering that material, because that's when the material becomes believable. It's very easy for a professional to stand up in front of a room and lecture to people. But you do find that very often people may be kind of skeptical of the information you're sharing with them. When somebody who has a similar lived experience is able to stand by a professional, be they in the HSE or in the voluntary sector, and acknowledge that, well, yes, this material that we're sharing with you tonight, I have actually used this myself and it has worked for me. It has made a difference in my life and it has helped me to achieve so many different things in the journey of recovery. And hopefully that by participating in it as well, you might enjoy some of that success also. And it's amazing the impact that has, that involvement has on people who then engage with that program or that course. Once they sort of get that validation, it makes such a difference. You know, it lets a person see that actually this might work, and maybe I will go home tonight and I'll try this out, because if it worked for that gentleman or that lady, it may very well work for me as well. So the co-production and co-delivery when we talk about recovery education is vitally important. And I might just mention, just before I finish up, a great example of that is over in the Midwest. If anybody ever wants to do a little bit of research on the internet, there's a fantastic innovation over in the Midwest of the country called Friends. That's Friends. It's a brilliant collaboration between the mental health services, organizations in the voluntary sector, particularly Shine, and a group of relatives, you know, people who are supporting a loved mental health difficulty, who have collaborated on a number of different fronts to develop education courses, to improve the level of involvement that relatives have in the delivery of the mental health services. And ultimately, I suppose the hope is that that collaborative approach will help to mold and design how the mental health services will be delivered in that region in the future. And I suppose if we could try and achieve a similar model like that on a national level, it would be fantastic. So
that's brilliant. Thanks very much, Derek, there. Yeah, and a shameless plug there for Friends. Fair play. It's great. And shout out, of course, to Balachnua as well. We have Maria here. So we have, no, that's brilliant. And it really just, I suppose, just shows the benefit of having the person with the professional experience, you know, years of training and working in the area, and then how it can really just blend so well with the person who has the personal lived experience and years of walking in the shoes, who can bring just so much to it as well, and how that can really work in recovery education. So thanks so much for that, Derek. That's brilliant. I get to now ask my co-host a question, which is great. So Michael, I'm going to ask you a question about RAP. So can you tell us, is there a RAP program for family members who are given support, or is it the same process?
Thanks, Gina, for that question. I get this question many times when I deliver RAP programs. One of the things that is important to note here is when you're looking at RAP, you're looking at your own individual recovery journey. Now, whether that is your own individual life's journey or something else. So basically, in RAP, you're looking at yourself and how you can support yourself and be assertive in yourself to make sure you keep yourself well. And that's sometimes it's delivered to service users or people with lived experience, and sometimes it can be delivered to other people as well, family members, carers, and so on. And the thing is, to answer the question quite briefly, the answer to that is there's no separate RAP course for family members or carers. It's everyone together, and that's kind of brings the whole kind of co-production ethos of recovery education into the fore as well, because we don't want to segregate people into this lot is service users, this lot is family members, carers, this lot is service providers. Everybody's equal, everybody has their own experiences, everybody has their ups and downs, and we all learn from that. And RAP regardless of what category you put yourself in, RAP is where RAP can be applicable to everyone, because it's about your own personal life journey. It's about how to look after yourself. What are the things that keep me well, but what are the things that starts getting me a little bit unwell? And you look at that, and it's not looking at that for your supporter, for the person you're supporting. It's looking at that for yourself as an individual person, because really, I always use the analogy of you're on a plane, and the first thing they show you is the kind of safety list, and they always show the mask, and they always say you need to put on your own mask first before you put on the mask of your children or other loved ones. And that's simply because if you don't look after yourself first, you can't be expected to look after other people. And that's why RAP for me is really, really important, because it helps you identify, hold on a second, yeah, I might be a supporter, I might be a family member of someone who has a mental health or addiction challenge, but I also have my own needs, and I also have things that I need to do to look after myself. And that's not being selfish. That's just making sure you look after yourself so you can be in a position to look after other people as well. So in short, in very, very short, the answer to your question in regards to is there a separate RAP for family members and carers? No, there's not, because everybody is on their own unique journey, and RAP is applicable for everyone. So thank you.
That's brilliant, Michael. Yeah, and the RAP, like I've done it myself. I know loads of people have done RAP, and I think when you have it done, it's so empowering. It really is, and it just makes you kind of realize actually we're all just on a level playing field, isn't it? I think somebody else used that analogy earlier as well, but we're all just on a level playing field, and we all have challenges and ups and downs, and it helps you to empathize with other people so much easier when you have your own RAP done, and just see that we all kind of need different supports at different times. So thank you, Michael, for that. And our last question, and I'd like to thank Barbara for joining us, and maybe if you wouldn't mind, Barbara, just introducing yourself briefly before you answer the question. So the question that came in for yourself was, could you talk a little bit about long-term medication and the decisions and processes of coming off it, and the benefits and risks, and also how to be supported regardless of what the outcome is?
Thanks, Gina. So my name is Barbara Brennan. I'm a colleague of Derek's in Shine, and I run the Sea Change program. So that's the National Stigma Reduction Program. I also used to use the services of Shine, and have been through family recovery myself, as I'm a suicide survivor. So I have a history of long-term mental illness, which I'm very grateful to say I'm living in the recovery journey, and I'm 12 years well now. So it kind of incorporates all of the stuff that we talked about when we had our conference, and through all the questions that you've been talking about today. It kind of covers all of that. So I suppose that there's a number of different pieces around the medication piece, because I get asked it a lot, particularly because when I was on medication, I was on up to 50 tablets a day for nearly 15 years, which was really severe, but it was what was necessary for me at the time. And when I say to people now that I'm not on medication anymore, I think people assume that I'm advocating to get off medication, which I'm not. So what I advocate for is that people discover, and it was something that that Derek said about exploration, this idea of what is it, so what does recovery look like for me, and if I don't know that, what would I like it to look like? Because that's the thing, that when you've been unwell for such a long time, and it's one of the things I think RAP is really helpful for, because I did RAP at least 5 or 6 times before I started actually getting it and implementing it. It was a process that I did, and I had this lovely book that lived on the shelf that I never used. And then I think that maybe the 3rd or 4th one, I started looking at it and going, what does that actually look like? So this idea of eat healthily, that's fine, but what does that actually look like for me? So I had to really break it down. So exactly the same with the medication, this piece around, well, what is it that I want to be more clear on what is it that, what outcome is it? Is it that I would like to be off medication or take less? And if so, why? What is the purpose of wanting to change? And this idea of advocating for yourself. So this idea of, you know, well, I want to be on different medication, or I want to be on less, or whatever the choices are that you're making. You really need to be very clear on why, and you need to be able to explain that to your family or supporters, to yourself firstly, but then also to your medical team. And that's the biggest thing for me, is that you never are doing it on your own, that it's not an idea to say, well, I want to come off medications, I'm just going to do that. You know, it is quite a challenging thing to do, and there are a lot of steps to get through, I suppose. So that process piece, it really is about having an open discussion with your doctor or medical team or whoever is in that part, and looking at, well, okay, what are the risks if I come off medication? You know, is there a chance that I'm going to get more sick? Is there a chance that other things are going to come up? You know, and if those come up, what do I do? What steps do I put in place? So this idea of having a plan, and again, leaning into that wrap piece. You know, for me, I had a couple of different versions of the crisis part of that. So one part of the crisis might have been, if I am off medication, what happens if something negative happens to me, or I have a bad experience? What do I do? What are the steps I need to take? Or if I'm on medication and things aren't working out for me, what does that look like? Is it that I can't manage the symptoms? Is it that I'm becoming irrational? Or is it because I just feel really bad in myself? Is my mood jumping? Like, specifically, what does it look like? So that piece around exploration and the real clarity around why you want to look at something different about medication. Also this idea of the expert. So we always assume that going to the doctor, that they will fix us. And that's one of the things that I think kept me ill for such a long time, because I kept going to all these different people for them to fix me. And the problem was, while I had that thought and I had that idea, I also didn't do the other stuff. And I think that's the biggest thing. So this idea of, well, just changing medication, it's not enough. You have to be holistic and explore. So going back to what Derek said about that exploration of recovery and that whole piece, what does that actually look like long term? And so certainly when I came off medication, it was about, what else are you doing, or what have you done up to now? So it was looking at, you know, that piece around food, and not just healthy eating, what works for you, what doesn't work for you, and having multiple versions of that. So on a good day, what does it look like? And on a bad day, what does it look like? And if I've had 3 bad days in a row, how do I turn that around? So being really, really clear and putting those steps in place if you can, because it's always easier to plan when you're in a good headspace than when you're in a bad headspace. And when you're in a bad headspace, to have that piece of paper to say, oh, that's what I need to do today. That really, really helps. I think that the thing around when you're going through the process, so when you decide with, you know, with whoever your supporters are, whether that includes your medical team, your family, whoever that is, when a decision is made either way, it's really important to know several things. The first thing is, what's going to happen when I stop? How does that work? Over what period of time? What process is that like? Or maybe if I'm halfway along the journey and it's not working. So we all know medication takes a couple of weeks to kick in, it takes weeks to come out, and you have lots of experiences of different things in that. So to be very clear around, well, what do I do if I'm coming down off medication and I have lots of adverse reactions that I don't like? Do I continue stopping? Do I go back up again? Do I take something else? What do I do? So really to be very clear around, what is that? And in those spaces, if I decide I'm going to stick with it and I'm going to try, so what else can I do instead? What other things can I do in this time? And again, really that discussion around family recovery, it's really important to think about, what support am I going to need? So where do I go, and who will understand what these are? So maybe, for example, I found talking to the chemist really helpful, because I met the chemist an awful lot more often than I met my doctor at one point in my life. And there were certain things where I was taking one medication that was giving me really bad heartburn, and the heartburn was actually upsetting me more than the mood swings were. You know, so there's some really, really simple things that maybe if we spoke more to the people that are in our supportive community, we'd get a little bit more information. And I think Michael made the point around the family knowledge. So this idea that sometimes we've missed something, and again, I included that in my wrap when I was developing the robust version that I have now. I did my version, and then I went to my family and I said, can you fill in the gaps? Because I know when I'm not well, I only see some of that. So can you tell me what you notice? And can you tell me what you've noticed helps me, or what you think would help me? So in the same way, when I was starting that journey of coming off medication, that was a real discussion around, if I need something different, how is that going to look? And for example, my family would have said, you know, we're not doctors, we don't know about medication. So, you know, like, nearly don't put that on us, but also we want to support you, but we need to know that it's the right thing for you. So I think not being afraid to have the conversation is really important, and to be open with your medical team. Because here's the other thing, I cheated lots of times. I stopped taking medication and I would get worse, and I'd go into the doctor and he wouldn't know I had stopped taking medication. So obviously the next thing that would happen was he'd up my medication, and then I'd go back on the higher dose and I'd feel worse. So it's really important to have open conversations, and if it's not working out, to go back and to not be afraid to take that step. And I think then also looking at the supports, so looking at what is available to me. And I get asked lots of times, where do you find information about doing this? Quite often you can't, because it's so individual. And also, most often when you're on medication, it's probably for several different things. So it might be, you know, like, let's say if I, at one point, I had an issue with drinking as well. So I had to go and look in that area. You know, maybe somebody's been through a bereavement, so maybe they need support in that area as well. So that real holistic piece is what really makes sense. And I think it really is about being brave to have those conversations, and to say to your family, you know what, I'm nervous about this, and also understanding that sometimes it doesn't work out, and that there is no shame. If I try and come off medication and it doesn't work out and I have to go back on it, that's okay. And I think that's a really, really tough conversation, and it can be really difficult, and you can feel really sad about it, and you can be worried about it. And I think that's an important part to address, to say, if I come off medication, how long will I be off it? It's not a forever thing. So it might be that maybe something will come up in the future and it will give you a knock and you'll need to go back on. Maybe it's temporary, maybe it's long term, but to allow yourself that space, that compassion, that kindness, and also to have that conversation with the family to say, look, it's not that I'm going to be off medication forever, but I'd like to try. And I think that's the biggest thing. So again, just being clear, having conversations, being inclusive, and realizing that actually you are the expert. So not giving your power away and letting other people make decisions for you, but not being stubborn about it, you know. So include other people's conversation and work out what is the best for everybody, and that there are different points that you get to, and you can always change your mind at any of those points.
Thank you so much for that, Barbara. I really, a lot of what you were saying in your comments there really kind of stood home for me, and I could really understand where you're coming from. I suppose what's really important, and what you've highlighted several times, is to make sure that if you are thinking of medication reduction, is that you're open, you're honest about it, you talk to your medical team about it, and you work in consultation with them, but also keeping in mind the holistic parts of the recovery journey as well. Having chats with your parents, your carers, your supporters, you know, doing your RAP plan, all these kind of things that would help you to stay well, get well and stay well for longer periods of time. So thank you so much for that, Barbara. And now I'm
going to be rude and jump back in and actually say, most likely, if you have a talking therapy, you need to lean on it a little bit harder during that time to deal with the issues. So I should have also said that, so sorry.
No bother at all, Barbara. And that's a very valid point as well, because you know, the most important thing in any kind of situation is to have those open and honest conversations with people. So thank you for that. I'm now going to pass you over to Aisling, who is going to close our session today. Thank you.
Thanks very much, Michael. I didn't think it would be possible to be overwhelmed again by the wealth of knowledge. The Family Recovery Conference was just amazing, and today is really carrying on from that, and it's just been fantastic to hear everyone speak again, and I could listen to you for hours on end. So I just want to say thanks to everyone involved today. I really think people will gain something positive from watching this video, and the panel covered so many aspects of personal recovery, family recovery, and general well-being, and that's really important as well. All of the questions that came in were reviewed with the group, so we ensured that the answers were co-produced, bringing the richness of experience together. and all of the relevant stakeholders were involved, so we could get the most relevant and up-to-date information. So that was really important to us as well. We want to continue the conversation on family recovery, so please do seek more information through the Mental Health Engagement and Recovery website and the Mental Health Ireland dedicated webpage to family recovery. And I suppose through social media and using Twitter again as a platform, and reaching out to any of ourselves here that are involved, if you want to be involved in family recovery and maybe learning a bit more about it. So thank you very much to everyone again today for being involved and giving us your time.